So anyone going anywhere in a group of people defined as more than 100, more than 200, it depends where you want to draw that line, should be concerned about potentially getting an illness from someone who is asymptomatic or has minimal symptoms. What you can do to protect yourself is not put yourself in that situation, not go to large group settings, try to avoid being exposed to anyone who's sick. And then deciding for your own self, based on your medical history and based on the people that you live with in your house, how comfortable you are in the day-to-day activities that we all do, going to the grocery store and things like that. I think as this epidemic progresses and we start to see more and more cases, I think you'll see people curtail their activities based on what we're all seeing. So it's difficult now to tell people in Alabama you should make drastic changes to your life and not leave your bedroom, because we don't have cases that are confirmed yet. But if we get to the point where we do have a lot of confirmed cases, where we have a lot of people who are very sick, that's when the story's going to change. And I know that you'll all be on top of that. Isolation is what happens to someone who has symptoms. So if you have a child who has symptoms, who's coughing with a fever, you would isolate them, meaning not let them go to school, isolate them in the house, not have them go out to expose other people. Quarantine is someone who's not sick but may have been exposed. So if you are working in an office where other people have coronavirus, you may be asked to quarantine, feeling fine, to wait 14 days to see if you develop symptoms, so you won't then inadvertently expose other people. How much time is it between being exposed to someone with coronavirus and having symptoms yourself? It's about 5 days. So in those 5 days, the virus is increasing in levels in your body, but you feel fine until the 5th day when you have the typical fever, cough, difficulty breathing. There is some new data that maybe people can transmit the virus before the symptoms start, and that's a big concern for us. Most of the studies are showing that the transmission is happening from symptomatic people. So it looks like most of the virus and most of the transmission is not before but after symptoms start. That's why we're focusing so much on people who have symptoms, saying if you have symptoms, don't go to work, don't send your child to school if they're symptomatic, that type of messaging. And they're changing the plans every 12 to 24 hours based on new data that's coming in. And the team is well equipped. There are a lot of ventilators and there's a lot of critical care doctors here, obviously a big group of well-trained pediatricians, adult doctors, geriatricians who know how to manage these types of diseases. So this is what they've been preparing for in a way. So the testing is all being run through the Alabama Department of Health and with the CDCs. There's testing available in every state and in Alabama, obviously, too. The testing is being prioritized for people who meet certain criteria, either known exposure to a case, known travel to an area where there's coronavirus, or someone who's sick with typical flu-like symptoms. Patients are being encouraged to call providers, and providers are the ones who have to recommend this test. All the algorithm is based on that. The system is ramping up rapidly, and we're expecting even in a week to have access to more testing than we do today. We are fortunate to be working at a university that's really been at the vanguard of doing antiviral treatment and testing for some of the world. And our labs are developing an in-house PCR-based test. It's not up and going yet, but the team is working hard on that. We know in states that have more testing, like in Washington state, that the more you test, the more disease you're going to find. So we really think that we're at the stage right now where we would like to test more. There is somewhat of a limited capacity in terms of the number of these tests. We only want to do ones that are verified and proven to be high quality. We don't want to tell people incorrectly that they have coronavirus when they don't, or vice versa. Tell someone that they don't have coronavirus when they do. So there are safety measures in place to make sure that the testing, when it's available, is really high quality. Yeah, so the process is that the testing is done where the virus would live. So it's usually testing in the back of your nose, the same way a flu test would look like. And sometimes in patients in the hospital, a deep respiratory sample if they're on a ventilator, for example, to get a really good sample to look for virus. The sample has to be put in the right type of media and then sent to ADPH or sent to CDC, which can take from hours to a day. The turnaround time of the PCR itself is a period of days. So we're telling patients that if the testing is being sent off, they're not going to get a result within hours, but they should know within a couple of days. The question about the different risk levels in the house is a really important one. With most flu-type illnesses, we had this U-shaped epidemic curve where babies and the elderly are the most impacted. And what's really unique about coronavirus so far, as you probably all know, is we're seeing it impact people above 60 with medical conditions the most significantly. So within your household, you can risk stratify based on that. You want to keep yourself healthy so you don't transmit to your mother, to your father, to your grandparents, to older aunts and uncles or neighbors who are in that age group. As far as cleaning, this is a droplet spread cold virus. So when someone coughs or sneezes or sings, you can have droplets that hang out in the air and eventually will land on any flat surfaces. So it's things that we touch. It's the telephone, it's the doorknob, it's the cell phone, it's the TV controller. Those are the things that you want to make sure to clean carefully. Anything your hands are touching is what you want to clean, not the drapes. You know, you don't have to do a full house clean every 12 hours, but if you can clean the surfaces with Lysol or with something that has a good alcohol level, that's how you can kill some of these germs. Well, I mean, we think that children may be carriers, so it's not that children cannot get the illness, but the mortality rate in children is incredibly low. So your child may be having mild symptoms and still could give the illness to your grandmother or your grandfather or your aunts and uncles. So in terms of thinking about risk, the older people above 60 with medical conditions is definitely who you want to think about. There are other patients, stem cell transplant patients, cancer chemotherapy patients. I take care of HIV patients. All of those patients have a reduced immune system, and we think they're probably also going to be at risk. So those are the people you want to be most careful about having them not go into public if they can avoid it, not get on plane flights if they can avoid it, anything to reduce that risk of exposure. Good questions. So what we know for flu virus is 2 to 7 hours. It's looking like it's about the same for coronavirus. Studies are ongoing. Like anything else, if you're coughing into like a wet Kleenex, that's a place that a virus can live longer than if it's a dry surface that's cleaned frequently.